is Kinley Calloway. I am a student nurse at the University of South Alabama, and today I will be performing my medication administration skills checkoff. To begin, I would follow the hospital no interruption zone policy. I would keep any conversation with my colleagues limited to anything that is necessary. I would keep the doors to the medication administration room closed, and I would not answer any phone calls. I will now compare the medication administration record, which I will begin referring to as the MAR, and the patient chart. Here we have an order for heparin, 5,000 units subcutaneously every 12 hours. And it's also stated on the patient chart, heparin, 5,000 units subcutaneously every 12 hours. We have patient Jaguar J. Jones. Jaguar J. Jones, his date of birth is 8/25/1963. 8/25/1963. His medical record number is 417-6352, 417-6352. He has an allergy to penicillin and an allergy to penicillin. At this time, I would perform hand hygiene. So the selected medication is heparin. It states that on the MAR is heparin. It is not expired. It does not expire until 12/5/2025. And there is the medication. The route is subcutaneous, so we will be identifying the tuberculin safety syringe as our chosen needle. It has been 12 hours since Mr. Jones's last injection, so it is time for another one. This medication is administered as 10,000 units per milliliter. The dosage is 5,000 units, so we'll be giving him 0.5 milliliters. I will draw the same amount of air as the injection will be, so 0.5 milliliters. I will put that into the vial. I will dump out any bubbles. And I will recap the needle. It is sterile, and that is to ensure no needle sticks. So here is 0.5 milliliters drawn up. I will prepare a label for the syringe, and also, since we did calculate our dosage, I would verify that with another nurse. So here we have Jaguar J. Jones. He will be receiving heparin, and he will be receiving 5,000 units. To verify everything one more time, we have heparin drawn up from this vial, and the order also states that. We have drawn up 5,000 units. It will be administered subcutaneously, which is why we're using the tuberculin needle, and every 12 hours, and it is time for another injection. We have the right patient, which is Jaguar J. Jones. Jaguar J. Jones. I will now label my syringe and prepare it to take to the patient's room. I will bring my MAR and my syringe to the patient's room. Upon entering the patient's room, I would perform hand hygiene. So we would verify the 5 rights of medication administration. As upon entering, we have an order for heparin, 5,000 units, heparin, 5,000 units, subcutaneously every 12 hours, subcutaneously with a tuberculin needle, and it has been 12 hours since his last injection. It is for patient Jaguar J. Jones, which I will now identify using two identifiers, his armband compared to the medication administration record. Here is just a visual of his armband. We have Jaguar J. Jones. Jaguar J. Jones, his date of birth is 8/25/1963. 8/25/1963. His medical record number is 417-417-6352-6352. And he has an allergy to penicillin. So Mr. Jones, I do see that you have an allergy to penicillin. Our medication that we will be administering today is heparin, so everything should go perfectly. You should not be allergic to this. And now I will explain the procedure to the patient. Mr. Jones, I will be giving you a heparin injection today. It's a very small needle. It will only take just a second, and it should not hurt. At this time, I would put on my gloves. And my goggles. Alright, and I will clean the injection site with my alcohol prep pad. I would also, if I was normally in the patient's room, I would raise the bed to a working height and lower the side rail. Whenever you clean the injection site, you clean from the center to the outside. And some nurses prefer to leave the alcohol pad pointing to the injection site that we would be giving it. This time, I will give the injection. I will spread the skin tightly and give it at a 90-degree angle. I would aspirate for any blood return, and there is none. And then I will give the injection. And apply gentle pressure and dispose of my needle in the sharps container. I will now remove my gloves and dispose of them in my trash can and my goggles. At this time, I would assess the patient for any allergies. I would leave the room and perform the 6th rite of medication administration, which is documentation. Document the medication I gave him, what time I gave it to him, and how he responded to it. And I would also reassess the patient as needed. And that is the end of my video.